All right, Landon, hit the disclaimer.
Hashimoto's, though, that's our cornerstone when we use it typically, though. Hashi's.
Gotcha. So I do want to now kind of switch into, I'd say, the more sexy stuff. What I want to start with is estradiol and guys. Anytime I say that, like, I don't block estradiol or that estradiol is beneficial in guys, those are the videos that get the most traction and views and stuff. I feel like most of these guys are still using estradiol as a scapegoat for any negative symptom associated with TRT, and they're not realizing that it has so many benefits. I see you're very active in, forums and stuff, but are you still seeing that in the patients that y'all get from other clinics and stuff asking for aromatase inhibitors and blocking estrogen, that kind of stuff?
So yeah, exactly. I'm seeing, there's this movement I'm seeing, though, because I've been in the space for almost a decade now. So if you're like a patient who is coming from more of a individual clinician clinic like yourself, like Dr. Grant, those are clinician-driven clinics that the practitioner owns and operates and works there. Those patients nowadays, even the ones I've met at conferences and stuff, they're more well-informed. If they come from a franchise, an algorithm-driven clinic, and I'm not going to name names because I'm not trying to get us sued for anything, right, but if they come from an algorithm-driven clinic who has just some provider, rotating providers that's just there to collect the check, they're the ones that are on aromatase inhibitors because they hit a certain level and they still have that old-school mindset. But it's nice, though. People like you and me are trying to push the education and change the narrative that, look, dude, you don't trip out over this. You probably heard of the peptide. What is it? Sloop. People call it Sloop, S-O-U-P-P. Yep. You and I, we know this, but for the people listening, like the vast majority, it's not speculative, the vast majority of the benefits of TRT, at least half of them come from estradiol. Yeah. Yep. The insulin sensitization, glucose reduction, improved lipids, upregulation of lipid disposal, the myelination, the cardiovascular benefits, the nitric oxide production, even helping with spermatogenesis when introduced with fertility drugs. A lot of that comes from estradiol. Sloop, it works on estradiol receptors. It works like they go estradiol related, as they call it, but yeah. The whole amalgamation of the benefits you get from that, the metabolic benefits, the mitochondrial upregulating benefits, is similar to that you would get from the estradiol effect from testosterone, the visceral fat reduction, the mobilization of the abdominal fat, improving fatty liver disease. All those benefits you get from Sloop come from the estradiol effect that you would get from the TRT, increasing estradiol in the tissue. So if someone's going to say estradiol is a bad thing, horrible for you, but they're going to pop some Sloop, they're full of shit. Yeah. Because that pill kind of gives you those same benefits, man. It does. And the fact people take a capsule that augments the same benefits you get from TRT due to the estradiol just shows how freaking critical estradiol is to our health, man. Yeah. It is. That's just my 2 cents. Again, I'm tangential. It does it sometimes, but.
And so, in my clinic, I'm not even checking it because we know it will be higher on testosterone. I'm checking the conversion happens in the tissues, and that's when it does. And then this is just kind of a spillover. And I view it as largely an inactive metabolite. And so I just kind of removed it. It wasn't going to affect what I did anyways, but just so I wouldn't have to have a 5 to 10 minute conversation with every guy. And, a lot of them don't even know we don't have the conversation anymore, and they don't even know because it's not there, That has kind of helped from that standpoint. And so another part of TRT, I'd say one of the hardest things to manage is fertility on testosterone. And when I say it's hard, it's just there's a lot of other nuance out there. And I get guys sometimes, they'll be actively trying to conceive and somebody put pellets in them and didn't have a fertility conversation. And then I'll get some from another clinic who they have all of their guys on enclomiphene or gonadorelin or kisspeptin or something. And so it's trying to weed out that, my practice is I'll get them a sperm evaluation and bank it if they plan. Good. And then I'll bring HCG in or FSH if that's not working in the future. But
Good. It works.
Does kisspeptin, enclomiphene, well, enclomiphene has some uses, I think, to my opinion, but kisspeptin or gonadorelin have any usage that you see?
No, not really. You want to have it on an infusion pump? Seriously, like a pain pump full of gonadorelin strapped to the back? No, you ain't gonna do that. The half-life is literally, 30 minutes or something like that? You gotta inject it 4 times a day minimally to get some kind of response, no, it's not feasible, man. It's just really not.
You posted one on the Kisspeptin that you can just Kisspeptin your money by goodbye or something. That was a quote from you on one of the bills one time. I thought that was funny. I see their appeal in like it's upstream, and if we can keep that flowing, then it should keep everything going. Just in practice, like you said, gonadorelin, it'd have to be a continuous infusion or basic, a pump, which would be awesome, but it's just not feasible.
It's not feasible, logistical, or anything, man. When we know FSH, it directly stimulates the Sertoli production. It says, all right, balls, make sperm. But if you have someone who's not going to respond to that, there's a good chance they probably weren't responding in the first place anyway. And that's a very unfortunate situation. But we don't have a crystal ball. We can't predict those people. We can't. And that's why you're doing your due diligence. You're having that fertility conversation. You're telling them, look, dude, bank sperm. It's $300 a year. Not that expensive. It's really not. If having a child is that important to you, you'll spend $300 a year to bank your sperm, and you'll have that conversation with them that, this is a possibility. But I'll say this, almost everyone we've worked with to achieve a child has achieved a child. I mean, hell, my wife and I had ours, 10 months ago, and I'm 40. It works. I've been on TRT 10 years. You go to most clinics, most physicians, most providers, prescribers, they'll all say, oh, you've been on TRT 10 years, that never going to happen. I can guarantee most fertility clinics will tell me that would never happen. But it works when done appropriately. Assuming that you have the underlying mechanisms in place prior to getting on TRT that is conducive to producing healthy, viable sperm, it should, for most people, respond to these therapies.
Were you doing, like, if you've been on for 10 years, were you bringing in HCG once a year or anything just to wake things up? Or was it kind of dormant for 10 years, just in your personal anecdote?
So my lady and I were talking about, so this was, previous year, we were talking about maybe trying for the following year. And so what we did, we introduced just some HCG, a little bit of FSH, and a month later is like, so much for next year. We're having it now.
Yeah, awesome.
It's happening.
Yeah.
It's like, all right, I thought... Because I counsel most people, you might not even get a response for sometimes 3 to 6 months, and we had a response. But not saying that is characterized for everyone, but it was a very fortunate blessing. God blessed us, man. We were very grateful.
Do you use carnitine or glutathione for fertility adjuncts or anything at any time?
There's some studies that support that they can help out as well, assuming that, oxidative stress, which, let's be real, as you get older, you will have oxidative stress, and we talked about earlier, the little mitochondria, boop, 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 shoot off some reactive oxygen species. That builds up in practically any cell. So it'll be one of those things say you've got you on FSH-LH, or not FSH-LH, but LH, or FSH and HCG, and you really just want to kind of cover your bases, you could introduce those, but we've never actually had to. But there is literature to support that they can actually work. Yeah.
Nice. Whenever I started my clinic, I honestly thought my population was going to be 50 to 70-year-olds. But, man, really, if I have 2 guys, say I have 10 guys for that day, 5 are 35-year-olds and 5 are 55-year-olds, those 55-year-olds almost all will have higher testosterone than these 35-year-olds. Is that just something that I'm seeing locally, or do you all have a similar population? Just seeing that this... just young guys almost being poisoned and having these low testosterones.
I would say pretty much everybody that presents to us for the most part is probably 350 and under. I'd say that regardless of age, even though most people that present to us are probably ballpark 350 or lower, it's weird that I still see that in guys that are 25, 30, and I still see that comparable to guys that are 50, 60. So, they're all pretty much low, but it's weird that it's happening that much earlier, which... Again, we all have our speculations. Cadmium, heavy metals, glyphosates, the environment we're in. But it also brings up the whole spiel, what is a normal lab range? Well, and here's where I get a little tangential. A normal lab range, what does that reflect? It reflects a population of people. But if that whole population of people all sit on their ass 40 to 60 hours a week, watch TV 3 to 4 hours a week, don't exercise, don't get sunlight, are exposed to and just showered in fluorescent light, if that's what healthy is, then yes, that normal range reflects the healthy person. And if the healthy person is someone who's chronically exposed to environmental pollutants, heavy metals, pesticides, and has a shitty diet and shitty lifestyle, and you wonder why the range keeps changing, well, if that means you're healthy and normal, then I don't want to be healthy and normal, just to be real with you.
Right, yeah. Like even LabCorp's, I don't remember when it changed, but it was like, and now it's 260 to 916 in the last 10 years or so, and it just keeps getting lower and lower every time they reassess it.
That reflects that our society as a whole, even though we deem that healthy, is that truly healthy? No, I think that's just more of an acceptance that this is the evolution of our health decline, and that's just what we constitute as healthy, conducive for anything.
So I got trying to wrap up, but I'll ask just a couple. So you don't like these could be a full kind of conversation in themselves, but just the last hormones that we haven't. If you just briefly, do you utilize DHEA, pregnenolone, melatonin in these guys?
Yeah, when like clinically warranted, I will. Same as you, I don't do progesterone. I haven't personally ever found any need for it because 99% of the guys, thyroid will do the trick, cover the vast majority of bases. You have guys chronically having mitochondrial hypofunction. Thyroid can kick those back online real quick. But DHEA, say if you got guys who subclinical low DHA levels, a compromised immune system, sexual dysfunctions kind of lingering, DHA can really help with those. Melatonin, believe it or not, people think it's just a sleep hormone, but no, it's actually it's a great insulin sensitization hormone. You know, it improves your insulin levels. It helps circadian thermoregulation. In other words, you take it at the same time of day every day, it's going to help your body get into that comfortable sleep temperature, so to speak. It'll help regulate your internal thermostat so that you can get better optimal sleep. You have to be consistent with it, though. You have to take it the same time of day, you know, every day, be consistent with it. And a lot of times I find the clinical doses that actually get that better longevity effect, the potent anti-inflammatory effect, because the studies have shown us that it even acts like a COX inhibitor, like a cyclooxygenase inhibitor, kind of like, so look, it's great anti-inflammatory.
Right.
Usually, though, you're going to have to get higher doses, not like, you know, 0.5 milligram, 2 milligram. The over-the-counter doses don't really provide that. I'm finding guys are going to need 10, 15, 20 milligrams to really get better benefit from it. Seriously, like less joint pain, less inflammation chronically. That's what I'm finding. So I do employ those other hormones when needed.
Yeah. Is there anything on the horizon that you think is going to be awesome that would maybe change any of that? You know, the follistatin gene therapy, myostatin inhibitors, anything that looks promising in your eyes that may help in the future that is in the pipeline?
Nothing to know of. I'm one of those people that tries to avoid shiny object syndrome. Anytime you get online, man, that's all you get bombarded with all these the new peptides and new shit that people are trying to sell you. I'm like, look, dude, let's stick to the basics. Let's get your thyroid and your testosterone dialed in, and then let's just live a simplistic, basic lifestyle full of nutrient-dense food, is spent with having good time with your loved ones. Keep living within your tribe, living within what the foundation of our biology wants. You know, sunlight, sleep, and being happy and just being loved. If you can do those big levers, pull those big things, you know, I don't really think you need to worry about all the biohacking bullshit. I really don't. Yeah, so that's just kind of my philosophy. Avoid shiny object syndrome. I do, man. I'm trying to, again, I'm a less is more type guy.
Yeah, I think it's even Dave Lee said it at the Silverback whenever I went and you were a speaker at. He's like, just do what your grandma wants you to do. Go out in the sun.
To sum it up, man. Yeah, dude.
Play outside, eat food that she grew from the garden, go to bed at night when it gets dark because you're too tired from playing all day. You know, it's just that alone, I think, and then you feel the love of the grandma while you're there. I think that just encompasses so much that we forget about these days. It's just so easy to overlook with everything going on.